Okay, so small update. I did just get a call back about the cultures from what I sent out to see if it was a UTI, and apparently I don't have a UTI. So, which is strange, I guess. So they told me I can stop taking that medicine, the nitrofurantoin, and which I've gotten really good at saying. It's a shame I don't have to say it anymore. Well, I'm sure I will when I relay information, but so they told me I can stop taking that, and that also does mean that I don't have a kidney infection because it didn't start. It didn't. It would still be in the urinary tract if I had a kidney infection. So then that points then that like redirects the question, recontextualizes the question to okay, so why? I can assume that like the random aches and pains were a side effect of taking that medication, outside of regular everyday aches and pains that I have just from existing. Which then brings it back to why was there not visible? There was no visible blood in the urine, but like trace from what they could see when they tested the urine, trace amounts of blood and trace white and some white blood cells. They didn't tell me how much. They just said trace urine, some white blood cell in the urine. So that could mean nothing. That could just mean your body just overproduced white blood cells for whatever reason and then flushed it out, or it could mean cancer, or it could mean other infections. But if I had other infections, you think other symptoms would be showing. I'd have a fever, I'd have all this other stuff going on. So it could have just been a series of random nothings that added up into making me think it was something, or something else underlying. And so now I just am trying to call my doctor's office, which I might as well play the lottery before I can get them on the phone, to make a follow up appointment and see if we can do any type of bladder cancer screening or check for kidney stones or anything like that. Check the bladder and check the kidneys are the two things I want to do, however I can. So I did call out of work today because I'm still feeling kind of crappy. I'm not as bad while I'm sitting here, but I'm still just like I'm nauseous. My stomach generally hurts. The Tylenol was helping with like the headache and stuff, and I did have some caffeine today to help with the headache. Um, but I am just taking today to rest as much as I can, and also come off the medication, so I should be fine tomorrow without the side effects, hopefully. But yeah, so that's a brief little update for you guys.